Hello friends, today we are going to talk about edema. Now edema simply means the accumulation of extra fluid in the body which leads to swelling. This fluid generally gathers in the spaces between cells or in serous cavities. The word edema comes from the Greek word edema. So, if you ever notice some unusual swelling in the body, it could be edema. Types of edema: intracellular versus extracellular edema. Intracellular edema: if fluid accumulates inside the cells, it's called intracellular edema, but technically it should be referred to as hydropic degeneration. Extracellular edema: if the fluid is between the cells, it's known as extracellular edema. Free fluid in body cavities. When fluid gathers in body cavities, it's called effusion. For example, ascites, when fluid accumulates in the peritoneal cavity. Hydrothorax means pleural effusion, when fluid is present in the pleural cavity. Hydropericardium, pericardial effusion, when fluid is found in the pericardial cavity. Interstitial edema: here fluid collects in the interstitial spaces, meaning between cells. If this swelling is just under the skin, present in the area with your finger will create a depression or dent, which is known as pitting edema. Non-pitting edema: this type of swelling doesn't indent when pressed. Examples include myxedema and elephantiasis. Localized versus generalized edema. Localized edema occurs in a specific area or organ, like pulmonary edema in the lungs or cerebral edema in the brain. Generalized edema, anasarca: this is systemic, meaning it affects multiple parts of the body, such as in the renal edema or cardiac edema. Transudate versus exudate. Transudate: in most cases, the fluid in edema is transudate, as seen in cardiac or renal diseases. Exudate: in inflammatory conditions, the fluid is exudate, which is loaded with protein and cells. Pathogenesis of edema. Let's understand why edema occurs. Decreased plasma oncotic pressure: when plasma proteins, especially albumin, decrease, the fluid balance in blood vessels is disturbed, leading to fluid accumulation between cells. Increased capillary hydrostatic pressure: when pressure in the capillaries is high, fluid gets pushed into the spaces between cells. Lymphatic obstruction: if the lymphatic system is blocked, fluid drainage is impaired, which can lead to localized edema. Tissue factors: factors like increased oncotic pressure of interstitial fluid or decreased tissue tension can also trigger edema. Increased capillary permeability: when the walls of the capillaries become more permeable, fluid can easily leak into the tissue and accumulate. Sodium and water retention: retention of sodium and water due to kidney function or hormonal imbalance can also cause fluid accumulation and edema. Now, examples of edema: renal edema, cardiac edema, pulmonary and cerebral edema. Renal edema occurs due to kidney problems such as nephrotic or nephritic syndrome. Cardiac edema is common in heart failure cases where fluid accumulates in the lower body due to gravity, and pulmonary edema means fluid accumulates in the lungs which can make breathing difficult. And cerebral edema occurs when fluid accumulates in the brain, leading to neurological problems.